All right. So during a medical examination, a cadet in the Naval College was detected to have a painless, guys, look at it, painless, dense ulcer of this size in his perianal area at 2 o'clock position. The ulcer floor resembles an old fat. What is the provisional diagnosis? Again, we've done this before. So basically, when having a painless ulcer or a painless sore around this area that are resembling an old fat, usually we are referring to what? A cankering. So over here, we're looking at what? A hard syphilitic gangrene. So, and usually this is, it is part of the primary stages of syphilis. So over here, we are looking at what? At C as our answer. C. A 32-year-old woman complains of a tumor-like formation on the anterior surface of her neck. So again, you have the differentials. The surface of the neck. So it has to do with the thyroid gland or all that kind of stuff, isn't it? But it's a tumor-like formation that appeared 2 years ago. 2 years ago. Within the last 3 months, the tumor has been rapidly growing. It hinders swallowing and impairs speech. The tumor causes a sensation of pressure. Objectively, the skin moisture is normal, pulse is 80 per minute, it's rhythmic, blood pressure is 130/80. In the right lobe of the thyroid gland, there is a dense, lumpy node that moves during swallowing. It moves during swallowing. Scanning images shows a cold nodule in the thyroid gland. What is the diagnosis? Definitely, we are looking at a thyroid cancer. We are looking at what? A thyroid cancer. And again, in thyroid cancers, usually it is painless nodule that is found at the thyroid region of the neck. And sometimes the first sign is an enlarged lymph node. The first sign or the sign that comes early are enlarged lymph nodes. And later, of course, we can have the pain, we can have changes in the voice, we can have the changes in voice because of the growth of the tumor or the cancer that is affecting or that is touching or impeding the recurrent laryngeal nerve. So we have voice problems. All right. So over here, we're looking at what? A thyroid cancer. Because it is progressively growing. It is what? Growing. And over here, they've told you the last 3 months, it has been rapidly growing. And that can only be what? A tumor. Sorry, a cancer. So the answer here is A. After a surgery for a left thigh phlegmon, the disease progression was complicated by sepsis. Of course, you know phlegmon, a generalized infection kind of a thing, isn't it? And it has been complicated by what? Sepsis. And sepsis is a severe form of an infection. So systemically, the person is having what? Infection. Now, on the 7th day after the surgery, there are marked signs of generalized inflammatory reaction. In blood, there are signs of toxic anemia and progressing hypoproteinemia. Bilirubin levels are 40. AST are exceeded the norm by 2.5 times. Oliguria is present. Name the phase of the sepsis progression. So definitely, you know that the infection is rapidly growing. In other words, it's in the acute phase. It is in the acute phase. So everything is rapidly growing. Whatever thing that is there, it is causing more harm, isn't it? And of course, like I said, we are having sepsis, and sepsis is accompanied by what? High fever, inflammation, immune activation, tachycardia, and acute phase response. Now, There's one thing I must understand during the acute phase response. Now, you realize that when inflammation is going on acutely, or when something is going on acutely, you realize that energy is being what? Utilized. Isn't it? Energy is being what? Utilized. Why? Because reaction that's taking place is overwhelming. And that is why sometimes when people are having sepsis, they grow very weak. They become lethargic because their energy level is low. The energy level is low because of the increase in the inflammation or increase in the metabolism inside the person. Because now every part of the body is trying to respond to whatever bacteria that is there, whatever infection that is occurring. So every part of the body begins to work. And you know that, of course, energy will be what? Utilized. Energy will be utilized. All right. And that is why during this kind of phase, whereby energy is being what? Supplied or is being utilized, that phase is called what? Catabolic phase. Catabolic phase. Substances are being broken down to release what? Energy, so that the body can work to fight whatever that is there. So we call it the catabolic phase of sepsis. Catabolic phase of sepsis. Now, when you begin to introduce drugs, now the body is beginning to respond very well. Then we're not having what? Anabolic, and eventually we'll have what? A recovery phase. Recovery what? Phase, isn't it? So that is what happens when we're having what? Severe acute sort of what? Infection. Acute sort of what? Infection. That's why sometimes, if you realize, we have C-reactive protein, if you guys know what it is. C-reactive protein in acute phase is usually what? Very high. That's to tell you that things are going on in the body. And if you check over here, the C-reactive protein would definitely be what? Be increased. It will definitely be increased. So without wasting my time, just know that over here, we are having what? A catabolic phase of the sepsis. That is what's taking place. Catabolic phase. All right. Good. Another frostbite question. I think we've done this one before. But let's go over the question again. A 10-year-old boy who was outdoors in windy and cold weather developed moderate pain and tickling in his fingers and toes. When he returned home, his parents noticed that the tips of his fingers and toes were white, and their sensitivity was lost. Sensitivity was lost. As the affected areas were warming up, the fingers and the toes developed tickling and painful sensations. Skin pallor changed into redness, tickling stopped, mild itching, and swelling of the fingers appeared. Determine the frostbite degree in this child. Guys, we've done this before. And over here, you and I know that this is what? First degree frostbite. First degree frostbite. Please, if you want to know the different or what characterizes each and every single one of them, we have done it in one of our surgery bases. We did it in one of our surgery bases. So please do well to go over it again. Do well to go over it again. All right. But over here, we're definitely looking at what? At a first degree frostbite, because it is just what? Superficial. It is just superficial. It is not deep. It is not permanent, or the lot of sensation will not be permanent. Everything is just what? Superficial. So your answer here is B. A 16-year-old patient has made an appointment with an otolaryngologist. He complains of elevated body temperature and sore throat. Sore throat. Disease onset was 2 days after the patient ate 2 portions of ice cream. Pharyngoscopy shows hyperemic mucosa of the palatine tonsils. So now they've made us know that there's a problem with what? With the tonsils, the palatine tonsils. But look at it again. They said that apart from the fact that there is hyperemia, that means signs of infection or inflammation, they have what? An exudate, a purulent what? Exudate inside the what? The lacuna. Inside the lacuna. So what is your provisional diagnosis. So definitely from the description or from the morphology that has been given over here, you can easily say we are having what? A lacunar tonsillitis. A lacunar tonsillitis. That's what here your answer should be E. A 35-year-old woman complains of high body temperature and pain in the upper outer quadrant of her right buttocks, which developed after an injection. Okay, so it could what? Sepsis, isn't it? I mean abscess. Now she has been presenting with this condition for 3 days. At the site of injection, the skin is hyperemic, painful, infiltrate with an area of softening in its center. So again, it goes on to confirm that we are having what? An abscess formation as a result of what? The injection. And that's what happens when you are doing injection. You have to be very careful because sometimes if you don't do it properly, you can have, some sort of inflammation taking place over there. Now, this woman is diagnosed, is diagnosed with post-injection abscess. Post-injection abscess of the right buttocks. What tactics should the surgeon choose in this case? So definitely, since we have confirmed that this is a post-injection abscess, what you will have to do is to do an incision. All right. Of course, you want to drain the abscess or the fluid that has been accumulated inside. And of course, after draining it, you need to give antibiotics as well. Antibiotics as well. All right. So over here, looking at what we are having over here, our best answer should be what? E. Our best answer should be E. Abscess incision, sanation, and drainage of the cavity. That would be our best option. But of course, you must add antibiotics to it. A 65-year-old woman on abdominal palpation presents with a tumor in the umbilical region and above it. So tumor in the umbilical region and above it. The tumor is 13 by 8 in size, moderately painful, non-mobile, pulsing or pulsating. On auscultation, systolic murmur can be observed. What is the most likely diagnosis? So guys, look at it. We are talking about abdominal palpation. Abdominal palpation. So definitely whatever it is found in the abdomen. But again, on auscultation, we're having a systolic murmur being present. Systolic murmur being present. And you know that is the aorta that has to do with this kind of murmurs, isn't it? Great. So definitely whatever that is happening, it is happening inside the abdominal aorta. The abdominal aorta. So over here, there could be a dilatation or aneurysm of the abdominal aorta. The abdominal aorta. So abdominal aortic aneurysm. Aortic aneurysm. We've done this before in our previous presentation. So please don't get confused. So over here, we are looking at at abdominal aortic aneurysm. So here we'll go for For A. Okay. Again, the palpation is the abdominal area. Okay. Around the umbilical region and above it. That is where we can find the abdominal aorta. All right. A 32-year-old man complains of pain in his legs that intensifies during walking. Guys, we've done this before. That intensifies during walking, intermittent claudication, numbness of his toe, extremity coldness, and inability to walk more than 100 meters. You remember we were talking about something like this is more or less like having atherosclerosis, isn't it? Whereby but this one has to do with the heart, whereby the coronary artery is, sclerotized, if I should put it that way, isn't it? But over here, we are having this thing taking place in the lower limbs. That is in the legs, in the legs. Okay. Now, when we have the kind of thing, we're definitely looking at what? We're looking at obliterating endarteritis. We talk about this. Obliterating endarteritis, which is just a severe proliferating what? Endarteritis. That's inflammation of the intima or the inner lining of an artery. And I think we distinguish this with another type of endarteritis, isn't it? And we classify or we brought out the differences between them. So please, if you've not watched the surgery videos, do well to go through them. And we distinguish it even between arteriosclerosis itself. We distinguish between all these three types of sclerosis of vessels, isn't it? Some is inflammation, some it has to do with the intima, the position inside the inner lining. So please do well to get a video on it and then watch it again. All right. So now look at it. Now when he sleeps, his leg usually hangs down. Patient has been smoking since he was 16. Good, you see. So now the risk factor here in developing this sort of obliterating endarteritis is the smoking. Because smoking will introduce some toxic or they are harmful to the vessels. Let me put it that way. To the intima or the inner lining of the vessels. Smoking is powerful, isn't it? So when something happens, then we are calling it obliterating endarteritis. Now the skin, he drinks alcohol too. All these substances are not good. The left leg is colder than the right one. The skin of the extremities is dry. No pores can be detected on the pedal arteries. So again, it tells that something has been blocked because there's no pulsation. No pulsation. However, the pulsation of the femoral arteries is retained. What is the diagnosis? We've discussed about it already. So here, we're looking at what? Obliterating endarteritis. All right. A 50-year-old patient was brought to the hospital with complaint of blood in the urine. Complaint of blood in urine, because you're not supposed to see blood in urine. Now, urination is, however, painless and undisturbed. Macrohematuria had been observed for 3 days. Macro means you can see with the naked eyes. Kidneys cannot be palpated. Suprapubic area is without alteration. That means the cystic or the urinary bladder is without any problem. Now, the external genitalia are non-pathologic. On rectal investigation, the prostate is not enlarged. It is painless and has normal structure. Cystoscopy revealed no changes. So what could be the reason why we are having what? Blood inside urine. What could be the main reason why we are having what? Blood inside urine. And usually the reason could be that there is what? Cancer development inside the kidney. Cancer development inside the kidney. And it could be at the initial stages. That is not very conspicuous over here, or it's not very pronounced in this question. Okay, but as time goes on, it will become more prominent for people to see, isn't it? So again, why am I saying that? Because of what? The microhematuria. That means you can see blood in the absence of other signs and symptoms and things like that. And without any pathology, it points towards renal cancer. Because renal cell carcinoma sometimes is asymptomatic. It can be asymptomatic. So it cannot be detected until after some time. And usually it's when you go to the hospital to do some other thing, but then you can find out that, oh, there's even a cancer over here and over there. So that's over here. We are going in with the renal carcinoma or renal cancer. All right. 59-year-old man complains of pain in his left eye and left side of his head. significant vision impairment of the left eye, nausea, vomiting. Visual acuity of the right eye is 1. Visual acuity of the left eye is 0.03. So the left eye has been reduced, isn't it? Attempt at correcting bring no improvement. Right eye, now look at the intraocular pressure. This is where your answer comes in. They said the right eye intraocular pressure is 21. And I remember I've talked to you guys about normal ocular pressure. The normal ocular pressure is around 12 to 22 or 14 to 22. Anything more than that could be a problem in the eye, isn't it? So if there's too much pressure in the eye, it can cause vision impairment and all those kind of stuff. Now they're saying that the right eye is 21. That means it's normal. But look at the left eye, 65. That is extremely. That's like 3 times the normal pressure, which is not cool. 3 times the normal pressure. And anytime we're having an increased intraocular pressure, the medical terminology is called what? Glaucoma. The medical terminology is glaucoma. So we can say in this question, we are having what? An attack of what? Glaucoma. 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 And of course, every other thing here goes on to buttress on the fact that we're having what? An acute attack of glaucoma of the left eye. The left eye. So your answer here is A. All right. On the 15th day after a small trauma of the right foot, the patient developed indisposition, fatigability, irritability, headache, elevated body temperature, and sensation of constriction, tension, and twitching in the muscles of the right shin. Twitching, tension, constriction in the right shin. What disease can be suspected? But look again, we're having what? A 15-day history of a trauma in the right foot. Now, when we talk about trauma, then you start thinking about what? Tetanus serum, isn't it? I mean, ATS, anti-tetanus what? Serum. Because if you have trauma and you don't give anti-tetanus serum, what can develop is what? Tetanus. And we are trying to prevent what? Tetanus from happening. And in this question, there's no history or there's no indication that this person was given a vaccine or was given anti-tetanus what? Vaccine or serum. And again, 15 days later, he's having all of these symptoms, including twitching in the muscles of the right shin. So again, this might make us suspect what? Tetanus infection. Tetanus infection, which is caused by what? Clostridium tetani. So here, we're looking at what? Tetanus. Tetanus. All right. A patient has the 2nd and 3rd degree burns of 15% of the body surface. On the 20th day after the trauma, the patient presents with a sharp increase of body temperature, general weakness, rapid vesicular respiration, facial features are sharpened, BP is 90/50, heart rate is 112. What complication is that? Guys, we have a 3rd degree burn. 3rd degree burn. And I've said it over here again, and I'm saying it again. Anytime we are having a burn, 1 or 2 complications that you can think about is the fact that there will be what? A dehydration. And secondly, there will be what? Sepsis. So in case of where there is increase in body temperature and vital signs are not conducive, definitely you are looking at what? Sepsis. You are looking at what? A complication of what? Sepsis. But again, this is what? 3rd degree burn. 3rd degree burn. So here, we're looking at what? Sepsis. 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 But of course, if the person develops shock, it could be because of what? The fact that there's what? Dehydration. Because the person is losing what? A lot of fluid. All right. 2 hours after a road traffic accident, a 28-year-old woman is in grave condition and was brought to a hospital. The patient, guys, again, take care of the history. Road traffic accident. So even before you continue further, you must know that in road traffic accident, whatever be the case, whatever be the case, in most cases, they end up having what? A pneumothorax, isn't it? Good. But maybe it's not pneumothorax, but let's continue. Now, the patient complains of abdominal pain, okay? He received a blow to the abdomen with the steering wheel. A blow to the abdomen, okay? So that means contusion could be present, isn't it? Now, objective examination revealed the following. Abdomen does not participate in respiration. And you know, normally your abdomen should participate in respiration. You can try it right now. Just try breathing. Breathe in, breathe out. You see your abdomen is moving up and down, isn't it? But here's the case. The abdomen does not participate in respiration. It is tense, acutely painful on palpation. So again, there could be signs of what? Peritoneal irritation, isn't it? Look at it. The abdominal muscles are defensively tense. Peritoneal irritation guys, they've already told you. It's positive. It's positive. Hepatic dullness is absent. BP is 90/60. What is your tactics? Guys, you want to open up this person. You would want to open up this person and treat whatever that is there, or check whatever that is happening inside the, which organ has been contused and whatever it is. Open up the person. Open up the person. So over here, we are having what? A laparotomy. Because we are thinking of a case of what? Acute abdomen or peritonitis. Let me put it that way. Or peritonitis. So here, definitely you require surgery. So please open the person up. So here, you go in with what? Laparotomy. Someone was asking me the difference between laparotomy and laparoscopy. Laparotomy is surgically opening the person up. Scopy is like making a small incision and then using a machine that's like a microscope, whereby it has like a television on it, or let me say, should I say television? Something that can help you to view the internal organs. Okay, that's scopy, laparoscopy. Then laparotomy is like opening up yourself. Opening the whole thing up and then looking at what is inside, instead of using a microscope or a small TV like that to look at what is there. Technically, that's what it means. But over here, we'll not do that. We want to open up. So the answer is C. A 48-year-old woman has arrived to the surgical unit with wounds in her thigh. Okay? On examination, the wound surface has dirty gray coating, guys. Dirty gray coating with unpleasant sweet smell. The wound resembles raspberry jelly. Skin tissues around the wound are glossy and turgid. Palpation reveals moderate crepitation in the tissue. What microflora is the most likely cause of such inflammation? Guys, definitely we're having what? Deaf tissue or necrosis, or if you want to put it, maybe gangrene taking place in this patient, isn't it? And usually one of the causative organisms are Clostridium. Clostridium. And you know, Clostridium, most of them are, or the one that causes these things are anaerobic. They are anaerobic. That means they can even dwell well without oxygen. Isn't it? So over here, we are looking at anaerobic Clostridium. Anaerobic Clostridium. So the answer should be D. Anaerobic Clostridium. All right. Because again, they have now the reason there's necrosis because there's inadequate blood supply to the place, and oxygen there is low and stuff like that. So the organ that will dwell much in these areas are the Clostridium. All right. So the answer is D. After a pain attack in the right subcostal area, a 58-year-old woman with overnutrition developed ecteric skin and sclera. Light-colored feces and dark urine. So jaundice. All right. Her abdomen is distended and painful on palpation in the right subcostal area. subcostal area. So you're thinking about those things, you're thinking of what? Perhaps the should I say the gallbladder, yeah. You're talking about a problem with the gallbladder. Palpation detect a liver enlargement, okay? So the bladder and the liver. Blood test, bilirubin level is 90, conjugated 60, which is high. What method of examination will be the most informative for diagnosis clarification? So over here, for us to have conjugated bilirubin of 60, which is more or less more than unconjugated, that means we are having what? An obstructive kind of what? Jaundice. This is just a little information. We're having an obstructive or a mechanical jaundice. So it's not a problem with the liver, but rather a problem with the gallbladder. So the question is, what test will you do to confirm your diagnosis? And over here, looking at the option that we are having, our best answer will be endoscopic retrograde cholangiopancreatography. That's what we're going to use to know what is wrong in this patient. So over here, you want to examine the liver, the gallbladder, the bile duct, even the pancreas, because the pancreas also is involved in releasing some sort of substances, isn't it? All right. So over here, we are looking at what? At A. All right. 11-year-old boy for a month has been presenting with increasing pain in the right femur. In the painful area, there is a non-mobile painful tumor with unclear margins. Guys, unclear margins. That draw your attention to something relating to tumor or cancer, isn't it? Unclear margins. And if a cancer is that big, it becomes non-mobile. But of course, sometimes cancer is small, it can move. Now, how do I know this? Because sometimes we'll talk about the breast cancers and then the all kind of stuff. We're able to distinguish between the kind of thing. So when the cancer is very small, it can move, isn't it? But when it's quite big, it becomes difficult to move. So don't say all cancers are not mobile. No, some cancers can move. With unclear margins. So the child complains of general indisposition, weakness, increased body temperature up to 39. X-ray shows widened medullary cavity. Small foci of, guys, you see, of cancellous bone destruction and onion-like lamellar exfoliation of the cortical layer. What pathology are you looking at? So again, for us to have a classic sign, so over you're having what? A cancer inside the what? Perhaps the bone, isn't it? And usually we're having, in this question, they give us a very classic description. And this classic description of saying we have a laminated or lamellated or onion skin type of periosteal reaction. This is normally associated with Ewing sarcoma. And this is a cancerous tumor that grows in the bones or even soft tissues around it. So over here, we're looking at what? Ewing sarcoma. Why? Because of that description of onion-like lamellated exfoliation. Very, very classic for Ewing sarcoma. So please take note. Unfortunately, I don't have this in here to underline for you, but please underline it on yourself. So the answer is A. A 43-year-old man complains of protrusion in the right inguinal region that enlarges due to strain. Again, what comes to your mind? Could be what? Could be hernia. Right inguinal hernia. And they say it occurs when there's what? Strain, maybe gymming, maybe push-ups, whatever it is. Now, he has been presenting with this condition for 6 months. Within this period, the protrusion has grown. Sorry, guys. Objectively, in the right inguinal region, an elastic protrusion of this size is visible. On palpation, it disappears, leaving an empty space between the pedicles of the palpate ligament. Guys, look, cough push sign is positive. I know this cough push sign is one of the things that, if I'm correct, Eugenia loves. Eugenia will always remind you of the cough sign, the cough push sign. So, Eugenia, this one, I know is a bonus question for you. So, make your diagnosis. So, over here, we're having what? An inguinal what? Hernia. But for the fact that it disappears on palpation and stuff like that, it means it is what? Reducible. It is reducible. So therefore, we're having what? A right-sided reducible inguinal hernia. Again, right-sided reducible inguinal hernia. So over here, your answer should be what? Should be C. Right-sided reducible inguinal hernia. All right. A 78-year-old man with a prostate adenoma. That's a second. Yes. A 78-year-old man with a prostate adenoma underwent a herniotomy. So again, hernia, right? For a direct inguinal was hernia. After the surgery, he presents with absent urination. Enlarged urinary bladder is detectable above the patient's pubis. What measures should be taken? Now, here's the case. You have an enlarged bladder. That means too much of urine has been accumulated. Why? Because the patient can always urinate after the surgery. So what would be your initial intervention? Definitely you want to drain the water, isn't it? So if you want to drain the water, what do? You pass a catheter. That's why over here, you should do what? Bladder catheterization. So your answer should be what? Should be B. All right. A 38-year-old woman has been brought by an ambulance. Patient has been brought by an ambulance to the surgical department with complaints of general weakness in disposition, black stool. On examination, the patient is pale, dotted hemorrhages on the skin of his torso and extremities. Digital investigation, there are black feces on the gloves. Blood test, hemoglobin is 108. Thrombocytopenia is present. Analysis states that a similar condition was observed 1 year old. Guys, 1 year old. Make your diagnosis. Of course, unfortunately, they didn't bring us the thrombocyte, and other blood analysis for us to know what is really wrong with this person. However, for us or for them to give us a clue of that this has happened before, like has happened or was there when he or she was 1 year old, tells you that this is thrombocytopenic purpura. Not hemophilia. Hemophilia deals with clotting factors. But over here, we are dealing with what? The platelet itself or the thrombocyte itself. And over here, they're saying they have a thrombocytopenia. All right, so that's over here. We are definitely going for what? Thrombocytopenic purpura, not hemophilia. Your answer is A. A 30-year-old man came to the family physician. 2 months ago, he underwent a surgery for an open fracture of the humerus. On examination, the patient's condition is satisfactory. the area of the post-operative wound, there is a fistula that discharges a small amount of pus. The area itself is red, fluctuation is detected, X-ray shows destruction of the humerus with sequestra. What complication has developed during the post-operative period? Guys, over here, we are looking at osteomyelitis, infection of the bone. That is called what? Osteomyelitis. And that can lead to bone destruction. It can lead to bone destruction. So again, what is the complication here? The complication here is what? Post-traumatic or post-surgery what? Osteomyelitis. Post-operative osteomyelitis. So as a result of the whatever that they did, perhaps some things went bad, isn't it? So we have what? Post-traumatic or post-operative osteomyelitis. So either the fracture was not properly taken care of, or even when it was, they couldn't do any prophylaxis for the person. So they develop what? Bone destruction. So here, D would be your answer. 3R, after trauma. A young man developed bradycardia. After trauma, we are having what? Bradycardia. Anisocoria. Hemi-hyperreflexia. Hemi-hyperstasia on the left, and a convulsive disorder. What the character of this process needs to be clarified. What method? Guys, even if you don't know what all of these things really are, but definitely you and I know that we're having what? A neurological problem, or we're having what? A brain issue. We are having what? A brain issue. Convulsion is there, hyperreflexia is there, hyperstasia is there. So definitely you want to check the brain and see what is wrong, isn't it? So quickly, you do what? A brain CT. So your answer is C. Brain CT. All right. The body of a 24-year-old woman with suspected poisoning has been found on the street. Suspected poisoning found on the street. Forensic medical examination was requested for an investigator during examination of the site and the body. According to the criminal procedure code currently in the force in Ukraine, forensic examination, medical examination is required. Guys, what do we do forensic examination? Of course, to know the cause of death. So the answer is what? Is A. Know the cause of death. A 37-year-old patient complains of pain in the spinal column, reduced mobility. The condition persists for 7 years. There's a sway back. There is no movement in the spinal cord region. X-ray shows a bamboo spine. Guys, we've done this. Bamboo spine. Bamboo spine simply means what? Ankylosing spondyloarthritis or spondylitis. Ankylosing spondylitis or spondyloarthritis. So, what is your answer? Of course, ankylosing spondyloarthritis. All right. A surgery unit received a person with an incised stabbed wound on the upper third of the right thigh. Upper third of the right thigh. So you ask yourself, what can be located at that area? Now, examination detected an incised stab wound of this incise in the inner surface of the upper thigh. Guys, look, bright red blood flows. So that means an artery has been damaged. Why? Because of the bright red blood. The bright red blood has been pulsating out. So characterize the type of bleeding. Of course, this is what arterial bleeding. Arterial bleeding. Arterial bleeding. In venous or in terms of venous bleeding, the blood flow is definitely flowing from a damaged vein. A damaged vein. So the color will be kind of what? Blackish in color. Why? Because in veins, there is what? Deoxygenation, or there's no what? Oxygen. And we know that oxygen carries what? Hemoglobin. And it's the hemoglobin that it carries that gives the color of the blood, isn't it? So in vein, whereby the tissue have already used up the oxygen, it becomes what? Blackish. So if they say that, oh, a blackish blood is flowing, then definitely you're talking of what? A venous type of bleeding. But over here, it is what? Arterial. Arterial or artery. So your answer is what? Is B. All right. A 47-year-old man developed the signs of decompensated laryngeal stenosis. Decompensated laryngeal stenosis against the background of acute phlegmonous laryngitis. He presents with inspiratory dyspnea at rest. Dyspnea at rest, forced position, cyanotic skin covered in the cold sweat, tachycardia, deficit pulse, low blood pressure. Guys, this person is having what? This person is having what? A decompensated laryngeal. That means that place has been blocked, isn't it? So breathing cannot take place. What do? Guys, you do the tube. You put the tube there. That's what you want to do. You put the tube there. So you do what? A tracheostomy. Do your tracheostomy. Guys, do your tracheostomy so that the person can breathe. That's the initial thing that you have to do. Do your tracheostomy. Do your tracheostomy. Okay? Just do it. Do it. Put the incision there. Let the patient be able to breathe through the windpipe, or if I should put it that way. So do your tracheotomy. Tracheotomy. So A will be most appropriate, because if you give oxygen safe, it will not go, because the stenosis, it will not go. Whatever you do, it will not go, because the patient is already in decompensated state. That means nothing can be done again. All right.